Welcome everybody back to afternoon 2 of our Parenting with a Brain Tumor series. I would like to just begin by, again, acknowledging the 3 programs that were able to come together to provide this programming for you: the UCSF Gordon Murray Caregiver Program, the Sherry Sabato Brisson Brain Cancer Survivorship Program, and the Milton Marks Family Camp. So for those of you that don't know me, I'm Margaretta Page. I'm a nurse here at UCSF. I currently co-direct and serve as the nurse coordinator for the Gordon Murray Caregiver Program. I'm joined today, this afternoon, by Dr. Abby Marks, who's a clinical psychologist here in San Francisco. Along with her clinical practice here in San Francisco, where she works with families with a parent who has a serious illness. Abby also has founded and directs the Milton Marks Family Camp. And then in addition to Abby, we're joined again today by Lacey Fetting, who's a licensed clinical social worker here in our cancer center, and Amy Arms, who's a marriage and family therapist. And she works at an organization called CARA, which offers grief support for children's, teens, families, and adults. I'd also like to acknowledge in the background, you might notice Naomi Hoffer and Mary Destry, who are providing the ever important background and technological support for us. So thank you for our faculty and our facilitators today, for our background support, and thanks to all of you for coming back for day 2. So as we get started, I just want to take a minute again and invite you to just fully arrive here at our afternoon. And so let's just take a moment and let go of your morning and your lunch, and just let's settle in and be together for the next hour and a half. And maybe we can just take a moment and either just close your eyes or just gaze at the floor or this beautiful image. We'll just take the next minute or so just to do some deep breathing. Okay, now, if you're ready, I just invite you to open your eyes again. And let's just take a moment to think about what it is that brought us all here. And I think all of us would say it's the brain tumor and our children. And when you look around at some of the ways people have described serious illness for families, some people have described it as feeling like a storm, and one that has squalls and downpours, maybe drizzle and some clearing. And so I just want to take a minute just to let us think about that. And I'm going to share this beautiful poem. Let's see. That's from a book called A Tiny Boat at Sea. There is a storm at sea. The waves are high and rocky, knocking any sailing vessel about relentlessly. There's a tiny boat out in the stormy sea, holding a family. Though the storm rages, the members of the family in the tiny boat stay close to each other in the center of the hull. They are warm in the lamplight there, feeling each other's presence and love. Somehow, here in each other's loving presence, the storm seems more distant. Later, what the children remember most about the storm are the caring faces of their family. So I think that's where we'd like to start today, just to give you a few minutes to reflect on this. Maybe jot down some notes, and then we're going to break into some groups and we'll give you an opportunity maybe to share your reflections with each other. Maybe you'll want to think about, what are the waves? Are there some waves right now that are knocking you about? Or maybe some of you are in still waters, or you want to think about that center of the boat. Or honestly, you can really go with whatever comes to mind. So we're going to give you a minute or two just to think about that. And then you'll be whisked away into a breakout room and we'll have some time to talk about this. Okay. Are we all back, Naomi?
Yes, I believe so.
Okay, great. Okay. Thank you for everybody for just sharing there. I'm going to just kind of keep things moving. I do want you to know, went too fast, that we are going to have you're going to have another opportunity to be with your group again, sort of after we go through some content this afternoon. So all of us thought that it might be nice for this second session to focus on some of the symptoms that a person who is the parent with a brain tumor might have, and actually some of the symptoms that the co-parent without the tumor might experience, and then how your child might see and experience all of this. So just sort of talk about what we know. I think when I think about it, just based on what we just read, we're talking a little bit about the waves, right? Some of the things that will maybe rock that boat a little bit. And then I hope that we can finish up talking about a few strategies that you can use as co-parent to navigate some of these changes that are the waves that a family who's experiencing a brain tumor is going through. Okay. I do want to just start by acknowledging that we have all kinds of people here today. We have people with brain tumors. Some are slow growing, some are more fast growing, some are big, some are small. We have some co-parents who don't have a brain tumor. Some of you have recovered and really have few of, if any, lingering effects. And then others might be having a little bit of a different experience with more symptoms that may truly add some more challenges to parenting. So just acknowledging that a brain tumor, there is a spectrum of this disease. And so as we talk about it, I just want you to always know that each experience is unique. And although there might be some similarities, certainly everyone's going to have their own experience with their symptoms and also the severity of their symptoms. And then I think what's even more unique is that those symptoms impact every family a little bit differently. So what do those symptoms mean for your family? So we're just going to start by talking about some of those symptoms. Some of you might have had some of these already. Some of you might be having them now, or they might be something that you experience in the future. We do know that if you kind of know that they're coming, or it's nice to know that they're there, and then maybe what to do about them, because sometimes parents can make adjustments that can enhance kind of their experience as a parent as they go through this. So the first thing I want to talk about is probably one of the most common symptoms experienced by people with brain tumors, and that's fatigue, right? And I just always like to remind people that this symptom is different than the kind of tiredness that people as parents had before they had a brain tumor. Tumor fatigue goes above and beyond what you had experienced before, and it can be related to the tumor itself, the surgery, sometimes the radiation, and the chemotherapy. And what we know is that it does ebb and flow throughout the illness. And for some people, it's kind of mild and more of an annoyance. And for some people, actually, it can be pretty severe and sometimes disabling for that parent. And I think what's kind of crazy making about it is that it's not always predictable. And the truth is that somebody can't push through it like they did before the tumor. So that's makes it a little bit harder. It's just different than the experience you had before. We also know about fatigue is that if you're having it, it can exacerbate almost every other symptom that someone might be having. For example, it can make cognition symptoms worse. It can make your mood worse or make someone's physical strength worse when they're tired. So as a result, a parent who's having fatigue might not be able to run from errand to errand, pick up the kids at school, cook dinner, and pay the bills after dinner. People do notice when they have this symptom, if they overdo it, it can cause them to be irritable. Maybe they have a little bit of a shorter fuse. And we know that the cognitive symptoms seem bigger. So people might have more trouble with memory or concentration, or their thinking just might not be as sharp. And if you think about it, all of those things can really have an impact on your relationship with your kids. So if this is a symptom that someone's experiencing, it really is important to recognize that you have a limited amount of energy to spend, right? And so it's true that we would recommend, and it may not even be possible to try to push through things. It's really sort of acknowledging that you have a fixed amount of energy. And so a parent with a brain tumor might have to make choices about how they want to spend their time. And when it comes to parenting, you might need to prioritize what's most important for you and what's most important for your child. For a lot of people who are experiencing this, it's really difficult to get to the place where you're thinking, I can't do things like I used to. And for some people, it can be frustrating and kind of depressing, right? Not to be able to get back to that, the way things were pre-tumor. I do want to acknowledge that this symptom from a child's eyes can be a challenging one. And that's because it's invisible, right? It's also intermittent and it's unpredictable. So sometimes someone can be able to do something one day and then not be able to do it the next day, and not through any fault of their own. So for a child, not knowing what to expect just can be challenging. And certainly families, because of fatigue, can find it sometimes hard to make a plan or to plan on anything. So our recommendation for a person who's experiencing, a parent who's experiencing tumor-related fatigue, is to just remember to differentiate this from your pre-tumor experience. We recommend, of course, letting the kids in your family know that you are experiencing this symptom. This is especially important for children, again, because of its invisible nature, and it keeps them from having to make up some story about why you can't be present. I think just being able to say, I really wish I could do this, but I'm not going to be able to do it today because the medicine or the tumors made me too tired today. Another symptom I want to talk about are physical changes, and those are the ones that occur when a tumor is in a certain area of the brain that might control movement or strength, right? And so parents with these kind of changes might have trouble with arm or leg weakness. And if it's severe, it could cause paralysis. And so that might cause trouble with walking or using hands for writing or eating or dressing, and may impact someone's ability to drive. Also, these kinds of symptoms can cause sometimes trouble with balance, and people can be at higher risk for falls. Now, again, when a parent with a brain tumor is experiencing these kinds of changes, it can feel sad and frustrating because they impact one's ability just to do normal things like walk or navigate around the house. You might not be able to do things like take the kids to school like you did, or drive the car, or maybe some of the activities that you did on the weekend, like hiking or biking. And feeling a loss around this is understandable and normal. What we have heard, though, for parents with tumors is that over time, they are able to think about new ways of doing old things. So kind of, reframing or thinking about that. Or many people find new ways of spending time with their kids. The most important thing is that you still show up, because truthfully, it really is your love and your presence and your attention to them that matters the most. And some people we've heard from really have found great satisfaction in just now being able to be home after school when the kids get home, or around after dinner, or maybe just being able to have that time to hang out on the couch and watch a show, cartoons on Saturday. So the key really to remember, if this is a symptom you're experiencing, is to try to focus on the things that you can do and just being present with your kids in whatever way you can. Sometimes tumors can impact the way people are able to communicate with their kids. And that's when it impacts the speech and language center of the brain. And I think all of us would agree that this symptom, being able to communicate, talk, could be a real challenge for a parent. So someone might have trouble making words or speaking clearly, or it just might take a long time. And then occasionally it can be where someone has trouble understanding what's being spoken to them. And so what happens is people often can communicate, but it just takes more time. And if you think about it, it really takes more patience on the part of the other party with whom you're communicating. So if it's a child, they're probably going to need some coaching around how to navigate that. And that often comes from the parent without the tumor. And so again, open conversation can help kids understand that the tumor is making it harder for mom or dad to speak, and maybe they can work on some ways to communicate. And it might be really slowing down, sitting with their parent when they're speaking to them. And then for some families where this is really a big significant symptom, it might be looking for new ways to spend time together and without words. For example, watching TV or music or movies, or listening to stories together. Okay. Mood changes. I put this on here. This is a group of symptoms that's pretty common for most people, even family members in this type of illness, specifically anxiety and depression. I think it's a normal reaction to the diagnosis. Many people, just with time and support from their co-parent and their family and friends, can definitely cope with this symptom, can manage it. But there are times when these kind of symptoms can be hard to self-manage and can get in the way of your relationship with your family, right? We know that a tumor's location and some of the medications that people take can really magnify feelings of anxiety and depression, and that can impact your interactions with your kids. So we encourage people, if they are noticing these kinds of mood changes, anxiety, irritability, and depression, if they're causing the parent distress, or one notices that their relationships are being impacted, or your ability to spend time and enjoy time with your family, it would probably be really useful and helpful to talk to your doctor, and or maybe talk with a therapist to help give you some skills to kind of navigate really some pretty normal feelings around this particular diagnosis. Another common symptom for parents with brain tumors, are cognitive changes. So this is a broad term that encompasses a lot of things, and it can be very mild, almost not noticeable, and for some people pretty severe, okay? When we're talking about cognitive changes, the thing to kind of think about it are things that many people think of as intellectual skills. So that's things like thinking, knowing, remembering, judgment, and problem solving, right? And when you think about those kind of skills, they require being able to read, pay attention, remember, and reason. And the truth with this particular diagnosis is that all of these can be impacted maybe by the tumor or the surgery, sometimes the treatments, and some medications can impact these things. So I think a lot of people with a tumor might notice, they would notice mild changes, right? So a little trouble with short-term memory, maybe remembering names, or if you think about it from a parenting standpoint, you might have trouble with the small details that in your child's life that they might have shared with you. We also hear about people having trouble. This is a big one that is subtle, but it's concentrating in a busy environment. And so you think about a household full of kids and a TV on and radio and music and conversation. That can be difficult for someone who has a brain tumor. So just acknowledging that. Another place where this could be difficult might be in a middle school or a high school gym listening to a basketball game. Sometimes it's just too much. People can't concentrate and focus down. Other things that parents with brain tumors notice is that it might be a little more difficult to multitask. So it might be harder to do things that you did before, like maybe get the dinner going and supervise homework. So it might be more important to do one thing at a time. And then some people with tumors in very specific areas may find that they have real difficulty with reading or calculating. So a lot of parents, if they have these symptoms, some people feel embarrassed by this. And as a result, these kind of symptoms can impact somebody's mood, and it might impact even how you feel about yourself and sort of challenge your self-confidence as a parent. So just be aware of that could happen. And again, talk with your co-parent and your doctor if it's problematic, okay? Because there are ways to work around some of these symptoms. There are some strategies, and I want to just mention some of them. So really, one adjustment people can do is just by trying to go back to doing one thing at a time. That can be really helpful. The other thing is noticing this whole thing about overstimulation. So I learned this from Dr. Chris Wire-Jamora, who's our neuropsychologist here, but she really taught all of us here at UCSF, and she works with patients to be aware that when there's too much background stuff going on, noise, TV, voices, it can be really challenging from a cognitive standpoint. And sometimes as a result, people can get irritable. So they call it overstimulation. So just be aware of that. The other thing, we talked a little bit about fatigue. We know when people are tired, that their cognitive skills can decrease. And then one tip, I thought this was a nice tip, and maybe some of you are already using it, but if it is your short-term memory, just having trouble keeping track of little facts, keeping a notebook with you to keep track of important things. And so some people keep track of important things that their kids told them about their day or things coming up in their life, so they can go back and ask them questions about them at another time or later, okay? I do want to mention two things just that can happen with brain tumors and are cognitive and can cause real challenges for parents and kids. And they don't happen to everyone, but they do happen. And I want to name them. So there are some tumors in certain locations that can impact one's ability kind of to perceive things like what's happening outside of them, and or their ability to kind of have insight into their decision making and things like that. So sometimes they have kind of real trouble being aware of what's going on. I like to call it kind of having trouble reading the room, right? And so when you think about this from a parenting perspective, areas where this might be problematic is, for example, let's just say someone, a father and a son were down on the floor and wrestling around. And you know how sometimes it can just get a little rough and someone will say, uncle, or stop. Sometimes it's hard to know for someone with a brain tumor in this area that they've pushed it too far. And so things can go one step too far. And so people can get their feelings hurt or maybe even physically get hurt. Another time it's hard is when we have maybe 3-year-olds who are defiant, or 4-year-olds who are defiant, or a teenager who's just being a teenager and maybe being sassy or defiant. And sometimes it can be hard for someone who doesn't quite have this skill because of where the tumor is. They might misperceive what's going on, and that really the child is trying to explore their limits or push. So sometimes it can be perceived by someone that very black or white, that they're being disrespected by the child. So again, just being aware that, so sometimes it can affect reading the room. And then kind of to the worst or the most significant is when someone's judgment would be impaired. And so they might not be aware that they're making decisions. This happens particularly with smaller children. And so children are put in unsafe situations, right? And I guess what's hardest about this is that sometimes the patient is not aware that this is happening, and that's because of where this tumor is. And so for both parents, it's just important to be aware that this could happen. It's if you can, it's a good thing to be able to talk through, kind of check with each other. Always remember, neither parent would ever want to put their kids in a place where they would harm each other, harm their children, either with words or maybe get a little bit too rough, or maybe inaction. So I think that's a safety thing. Maybe not being as attentive, and maybe not to a younger child. So always trying to work together on this. If it feels tricky, or maybe you're having a hard time coming to terms about whether or not it's a concern, it's a great thing to talk with your doctor about. We certainly have a neuropsychology service here at UCSF that can maybe help drill down and sort out if there are any areas that are what we call vulnerable. And then if there are any strategies that could be put in place to support a couple around those kinds of symptoms. Every once in a while, in a really extreme case, it might be that a family might need an extra adult around just to make sure that things stay safe. Okay. The last symptom I want to talk about is seizures. This is a symptom that many parents with a brain tumor might experience. Interestingly, it's more common in people with lower grade tumors. And those tend to happen in a younger demographic. So those are the people that are parents, okay? A lot of times a seizure is how a parent might find out that they had a brain tumor. And many times kids witness these, right? Sometimes a seizure is just a little funny sensation, but often it can be a little more intense, or maybe a lot more intense, like a grand mal seizure. So it is important, if seizures are happening, for a parent, if the children are old enough, to kind of explain what's going on in language that they know. And I think about it as an electrical storm kind of happening in the brain, and it can cause a seizure. Explain what happens. I think it's important for kids to know, truthfully, that a seizure isn't an emergency, and most times they start and stop there's nothing to do except make sure that the person is safe. It's also important to acknowledge that they're really kind of scary to watch, even for grown-ups. So a lot of times a family will have a seizure as the initial event when a brain tumor is discovered. And it's always important to kind of go back to your kids and talk this through, just to know what they think about it, because sometimes they have interesting stories that they've made up about the seizure, and so just helping them understand. And then if they're old enough, making sure that they know what to do if a seizure happened in the next time. If it happened again, what would they do, and who would they call, or how they might help their parent if that happened. Okay. Yeah, so those are the symptoms. I want to talk next a little bit about the changes that the parent with the tumor might notice as a result of the symptoms, and how that might impact their parenting. Okay, so when you think about it, when something like this happens, the person with the tumor, the normal reaction for someone is to kind of hunker down into survival mode, right? And so the focus really is on illness, on the illness and the treatment. And then kind of adapting to new normal. But what that means for the parent is a lot of times, because all of this is going on, they really do have less physical and emotional energy for parenting. So the focus is on the illness. That's normal. Okay. As a result, though, people can feel unsure and less confident, and they don't always know how they're going to feel. It's not predictable. That's some of the stuff that we talked about already. And that's hard as a parent because you don't really know how tomorrow might be. We also know that parents might not be able to do everything, at least immediately, that they used to do, right? It might not be able to get down on the floor and wrestle around or help with homework or drive carpool or coach basketball. And a lot of people are really hard on themselves, okay? So it's common for people to feel guilty. Sometimes they're angry at the tumor for taking things away, and sorrow is common as well. Another thing that people feel or a change is they might feel isolated. So really, there are not many people who can really know how you're feeling. And I think it's extra hard with a brain tumor because so many people with a brain tumor actually look very good to the outside world. So it's harder for people to know what's going on. We also know, and something that a parent with a brain tumor may begin to notice, is that certain symptoms exacerbate other symptoms, right? And we talked a little bit about that before, the fatigue, what it can do. It can make things worse. So just, becoming aware of that. And then also, although it's not a symptom, we know that certain situations or triggers can make symptoms worse. So it is sort of beginning just to be aware of the things that are going on for the parent, kind of taking stock of what one's experiencing so that you can modify as you're able your situation. I do also want to acknowledge that as time goes on and as people move away kind of from the shock of the diagnosis and those days of early treatment, people do get a better sense of who they are and what they can do, right? And it's really important as a parent to focus on this. And we hear people talk about it. It's that whole concept of establishing a new normal. And I guess I want to reassure people that you will find a new rhythm. And for many people, that rhythm is pretty close to what you had before the tumor came. And for others, it might be more different. But I just want to say you will get into a new rhythm. So up to this point, I've been talking about the parent with the tumor, okay? I do want to address what's going on for the parent without the tumor too. So in addition to supporting the parent with the tumor and making sure that they get the best medical care and that they can focus on the tumor, the parent without the brain tumor is actually the one who's kind of buckling down and holding down the fort, right? And making sure everything's going on at home. But as a result of all of that, they can have some symptoms related to the illness too. And I want to acknowledge some of those. So first, I just want to talk about role overload. So this is not unusual. The parent without the tumor is trying to actually fill in the gaps, the things that the parent with the tumor did while they focus on the treatment. So they're can sometimes get a little bit overloaded. Some people suffer from insomnia. This is a normal thing, a reaction to stress, kind of a lot on your mind, can be hard for people to sleep well. They can also be suffering from similar mood changes, right? Anxiety and depression are common in both parents when something like this is going on, and sort of the same recommendations. Some of this is normal, but if one is finding that it's causing a lot of distress or impacting their ability to have relationships with their family, then these are things that are worth looking into and speaking to your own provider to get some help with. Another thing that people sort of get to is exhaustion. It can just be so much sometimes that they can feel overwhelmed and exhausted. And also, the parents without the tumor also feel very isolated. So they too are having trouble finding anyone who kind of understands all that they're going through. And kind of if you look at that whole list, you can imagine if all of those things are going on for the co-parent without the tumor, it can impact one's ability to be their best version of themselves as a parent, right? So just acknowledging that both people are having some things, some challenges around parenting, okay? Some of the changes that the parent without the tumor is noticing are very similar to the parent with the tumor, very similar. They notice that the focus of their family is on the illness and the treatment, and everybody is adapting to a new normal, right? They notice that their partner might not be able to do the same things that they did before the tumor. A big thing they notice is that things are not predictable. It's hard. You just never know when things are going to come up. Another thing that's hard about a tumor is that the symptoms are invisible. So again, the parent without the tumor looks pretty good to the external world. And so this can be isolating for that parent, and it can be hard for kids to kind of make sense of things sometimes. Here's something. So we've been talking about how certain symptoms impact other symptoms. Sometimes it's the parent without the tumor that's the real observer on this, and they might be the first one to notice. So they might notice that when people are in hectic situations, that they're more irritable, or when they get fatigued, things get worse. They might be what I call the observer and notice these things happening first before the parent with the tumor. They often are needing to take on new tasks and new roles. They may be the one that has to explain things to the kids, depending on what's going on. So just being aware that they may be having to do the conversations with the kids. We also know that it can be lonely. An illness like this can make couples sometimes feel disconnected from each other as everybody's kind of dealing with the shock, and each person copes differently. It can be tricky. And this is your partner who you've normally solved things with, you may or may not always be able to work things through together around parenting. So that can feel lonely, and people do feel isolated on account of this. The last thing I just want to say about the co-parent without the tumor is that there's a tremendous sense of responsibility. I kind of call it the mama lion syndrome, but there is this need to certainly protect their partner and their co-parent. They're trying to make sure they get the best treatment and are well taken care of. And they have a responsibility to make sure that their kids are well taken care of. So this is a lot. Okay. So now I want to shift gears for a minute. So I've talked about the parent with the brain tumor, and I've talked about the parent without the tumor. And then we think about who else is in the family, and it's the kids. And I'm wondering, we talked about the changes that both of these co-parents notice. I wonder what the kids are noticing. And I'm going to take a minute here, and I'm going to stop sharing. And I'm going to invite you all to raise your hands, and maybe you can let us know some of the things you think your kids are noticing. So I think, honestly, I think some of us think our kids are going to notice the bandages and maybe an incision, but truthfully, what kids notice is how an illness impacts them, right? And so these are the kinds of things that they notice. They do notice that when things are chaotic and unpredictable. That is something they pick up on, and it's because they don't know what to expect. And so they begin to wonder things like, how am I going to get to school? Who's picking me up? Who's going to take care of me? So they as much as we can, sort of giving them some information so things are less chaotic and less unpredictable can be helpful. They also notice that both parents are less available for bedtime stories, walking to school, maybe having dinner together. Again, if they don't have explanations, they might make up in their own mind why those things are happening. We know that school age kids, particularly sort of middle and later elementary, think a lot about fairness. And they're thinking about how the illness impacts their routines, right? And they're kind of angry that the illness is interrupting their lives. And so you'll hear things like, oh, we can't go to Disneyland, or I have to miss soccer practice. It's not fair. Okay. So that's a common sentiment based on what they're seeing. They will notice that mom and dad are different, whether it's how you look or act, or things you may or may not remember. Sometimes mom or dad might be more irritable or withdrawn. And again, almost all of them will feel like they have some responsibility. So just making sure that they don't feel like they're the cause of that is important. We know that things are confusing. They see mom or dad, and they, again, look fine, and then things can change within a day. And again, this has to do with kind of the unpredictable nature of the illness and the fatigue. So things maybe that were happening that were fine last week might not be fine this week. So that can just feel confusing to a kid. And then the last thing is that people around them, I mean, rightly so, can be sad, they can be irritable, and they can be grumpy. And so they notice that. And we know even as we just heard, that infants can pick up on emotion, stress, and sorrow. So they do notice. They notice. So how do they respond? And I think what's interesting is that every kid's response to illness will be different. It's certainly based on their age and then where they are developmentally. That's going to play into their response, as well as their temperament. And then the other thing that's kind of important to take note of is how quickly the changes occurred and how those changes impacted family life. So, some changes might be have less of an impact on a family, and others might be more significant. So sort of take all those things take account. If you look at all the information that's written about kids' response to illness, it turns out that there are some very common responses that occur at each age. So what we know is that almost every kid, no matter where they are, is probably going to experience some regression. They're going to return to a previous developmental stage level. So what you'll notice for younger children, even older children, there might be just more need for snuggling and cuddling. The really little younger ones, we might see some behavior changes with bedwetting or accidents. This occurs for teens too. There will be a pull to regress to a younger age, but it's harder for them because they're also working on their separation. So this is a particularly hard response that teens do struggle with, and just to be aware of that. They're confused. They are very egocentric, really, so much. I mean, if you think about even the way we treat them, it is all about them. And so they really do sense and resent changes in their routines, especially if they can't explain them, right? A lot of them, as we've mentioned, feel responsible. So we want to make sure that we can explain it. They worry when things aren't explained. Mom and dad still love me. Who's going to take care of me? And in particular, they notice if the words and the music don't match. So they want to make sure that the words are matching what they see, as far as they see what's going on. Guilt. So this is a big one. And this is so often, no matter how, as soon as they're old enough to understand illness, they often feel like they might have caused it, or something they did made it worse. And they really do need a lot of reassurance that the tumor's not their fault, or, any little setback or anything, that they weren't the cause of it. A lot of kids worry about whether or not they should be having fun and having kind of normal childhood experiences when something like this is going on at home. So we want to make sure that they feel free to do that. We want to make sure that we give them opportunities to do that. Teens, this is another thing. Teens are wanting to separate, and that's a developmental milestone. But they struggle and they feel guilty about wanting to be away from home versus staying home. So again, making sure that this is something that kids are thinking about, reassuring them that they're not responsible, and then encouraging them to have a life outside of the family is okay, and some fun and normalcy. We also know that almost everybody, they might not say it, but they are having big feelings. They experience anger, they experience disappointment, worry, and fear, right? Sometimes we see it, sometimes it comes out. Sometimes it's great to make a place for them to have a chance to work some of this out. We know sports is a good place. For younger children, it might be having a corner where they can go and have like a punching pillow or something like that. So just, again, giving kids permission to feel these big feelings, and also acknowledging that some might not say much at all. And as a parent, you have to be okay with that. Maybe being there so that if they do want to talk about it is fine. But knowing that they might not. One other thing to be aware of is sometimes they don't always want to share with their parents. So making sure that they know they have another adult that they could talk to about things. Younger kids, it might be grandma or an auntie, or a babysitter, someone close. Older kids, it might be someone at school, a counselor, a teacher, or a coach, or maybe the parent of a best friend. So again, giving permission for kids, if you're not feeling like they're wanting to talk to you about it, that there are other people that they could talk about these big feelings with. The last thing I want to just mention is they feel out of control. And if you think about it, we probably, as you know, the parents might feel a little bit out of control. This is not a situation anybody is in control of. For kids, we want to try to give them as much, a little bit of structure and routine and a sense of control. That can be done by really helping them know what to expect. So sort of really laying out what's happening and what that means for them. And also giving them an opportunity to help out. So how can they help? Also, if they want to help, what they would like to help with sometimes can make them feel a little greater sense of control. And I'd like now just to invite Abby, because Abby, you might have some other things that you'd like to add to this area. You have anything?
Yeah, I think I would just reiterate the idea that a lot of kids' feelings about what's going on with you as a parent or the family when there's a brain tumor do have to do with a feeling of not having chosen this and to things not being in their control. And really, if you think about it, a lot of the ways this impacts us as parents is the same. It can just be so hard to be a parent right now, even just if nothing's going on, and then you add all of this to it, and it can be so not the way that we expected things would go. And for kids, it's the same. I think a lot of those feelings of it's not fair sometimes don't even get expressed because they don't feel like they're allowed to complain about the fact that it might not be fair that they're not getting to do things. If there's an atmosphere of like everything has to go towards making sure their ill parent gets better. And then that can lead to guilt too. But I do think that when kids feel out of control, we want to give them choice, even if it's in the small things as much as possible, what they're wearing or what cereal they're having for breakfast, or what of two activities they want to do, for example. But it's really hard when things aren't predictable, because I think that when kids feel out of control, when the kids feel like they don't have choice, the next best thing, if you don't have a choice, is if things are predictable, if there's a routine, because it doesn't throw you for as much of a loop, and you know things are going to be secure and okay. And this is really hard in an illness where things aren't necessarily predictable and we don't choose them. So I guess just other than that, what I would add is, one big takeaway from all of this is a hard, frustrating, overwhelming situation for everyone. And everyone in the family is likely to be operating kind of like, one of the ways I like to explain it to people who don't know, who haven't lived with a brain tumor, is it's kind of like, if you're in pain, it's really hard to do another thing that might be easy if you weren't in pain. Like if you have a really bad headache, it's actually hard to be like really patient and kind and happy about the day. And I think operating with any kind of significant stress is kind of like that. Your fuse is shorter. That goes for us as parents. We're more irritable, we're more on edge, and it also goes for your kids. So it kind of makes sense if all of this stuff is going on with them.
Yeah. Okay. Thanks, Abby. There we go. So I wanted just to give a few, I'm going to go quick here so we have some time to share again, but some strategies for parents around neuro symptoms. And I think wherever anyone is on the disease trajectory, really thinking about what is possible for your family now, and as co-parents, what are your goals? And it kind of prioritize together. And so it might be getting through the treatment, or it might be keeping the kids in school and keeping them on their teams. So just figure out what's important for your family, okay? Things change across the illness. So just knowing that, that's why it's important to check in, because people will have different capacities at different times. Again, communicating with the kids around the symptoms they're seeing. I think I just want to highlight, so this tumor and some of the medications that people take, steroids in particular, can cause irritability and anger. So that's a side effect of that medication. It's not much that people can do about, but if people are finding that the parent with the tumor is more irritable and angry than usual, it's important just that the kids understand that that's happening and why it's happening. I think I really like just allowing the kids to, if they want to vent their frustrations. The parent with the tumor and the kid can kind of join together and be mad at the tumor when there's something to be disappointed about, kind of externalizing the tumor outside of the parent to the degree that you can. I want to just go through some strategies. One big one in a busy household, is something called environmental engineering. And this is something I learned again from our neuropsychologist, but it really is looking at what's going on in your household. And, how hectic is it? How much stimulation? Is the TV on all the time, the radio on? Just what's going on. And then also for a parent with a tumor, being aware of safety, like where toys are and, things around the house, just paying attention. So look at the environment together, reevaluate what's possible. So really it does go back maybe to doing things one task at a time. If that's needed, that's good. And then because probably people are doing a little bit less, because that's better for everybody, it might be that as a family, it would be helpful to recruit and develop a consistent support team. So maybe you are getting a regular person to help with carpooling. Maybe you decide that it would be great to have someone at home in the afternoon when the kids come home to get them out to all of their sports activities or whatever it is. So just thinking about being mindful and planning ahead to get a consistent support team in, so that the kids have a team, additional people to rely on. So enlisting help and accepting help. Okay, so I think what we want to do now is allow you to have some time to go into breakouts and maybe think a little bit about a symptom that's been challenging. We touched on that a little bit already, and maybe some strategies that have worked for you, whether it's, getting some helpers involved or anything that's worked for you. I think it would be nice to share, or any other questions maybe that came up. So Naomi, I'm going to ask you to,
Yeah, so
break
we have
it
about 12 minutes, I guess.
yeah, that would be great.
Great. I'll give you a 3-minute warning. Thanks.
Okay. Are we all back? Fantastic. Thanks, everybody. I was hoping we had a moment to debrief a little, but I think I'm going to pass just to keep us on time. I do want to tell you about next week because we're kind of excited about it. It'll be a little bit different. We'll have just a little bit of content, sort of talking about what are the red flags that parents can look for. We want to talk about building a support system and being a family through all of this. But then we're really hoping to kind of open things up. We have 3 amazing experts here, Amy, Lacey, and Abby. And so I'm calling it an Ask the Expert session, but we'll have an Ask the Expert session. And that's really going to be an opportunity for all of you to come and ask any question that you want, and we can problem solve together. Some of you may have answers for the others, but we'll also take advice from and answers from our experts. So think about your questions and your scenarios and make sure that you bring them next time to take advantage of our expertise. Okay. For our closing, take a moment to imagine again that we're in a room together. I always like to imagine we're physically together. And if it's okay, I'd like to kind of go around the room like we did last time, and I'll call on you and just invite you to just share one word that you're leaving us with here this afternoon. So with that, we'll wrap it up. And I hope that all of you will come and join us again next week. Thank you so much. And if you have any questions that come up in the meantime, feel free to send them our way. We're here for you.